We are here live with Miss Columna, who is going to talk to us about the story of her daughter Leah. Hi, Miss Columna. Could you please provide us with information regarding the incident that involved your daughter Leah?
Yes, the morning of December of 2002, my daughter went in for a procedure called pectus carinarum, also known as pigeon chest. After the procedure, my daughter kept complaining of pain, and the provider gave her a medication called fentanyl, which was for to alleviate her pain, but they just kept increasing her pain medication, and when my husband and I noticed that she was just not getting any relief by it, we talked to the doctor and the nurse, and that's whenever the doctor basically decided to give her a new medication called Ativan, which was over the dose for her age and for her weight. Um, after the after the provider gave her or prescribed her the Ativan, and the nurse, you know, gave her the medicine, we noticed that our daughter was just not the same anymore.
Can you provide us with information about the care your daughter received?
After the procedure, I just feel like everything went wrong, from the care of the provider to the nurse, but specifically the nurse, as I feel like the nurse never went in to check her vitals, to check her respiration, see how she was doing after the pain medication to assess her. I also feel like whenever like my husband and I talked to her about my daughter not getting any relief from the medicine, she never advocated for my daughter.
Miss Columna, what was the outcome of the incident? What happened to the nurse involved?
What happened? Unfortunately, my daughter Leah passed away. What happened to the nurse? Honestly, I'm not sure.
How could the nurse ensure patient safety before and after the error occurred?
Well, I feel that one, after every procedure, major surgery like my daughter Leah, they could go in and check on the family and on the specifically the patient to make sure that they're getting relief from their pain medicines, assessing them, making sure that their blood pressure is normal, or their respirations, because with my daughter Leah, that's what happened. They kept giving her all this medicine and she was not getting any relief, but they never checked on her to see why not, if the medicine was going in the correct route, or she could just pay more close attention and advocate more for the family. Now we're here live with Fernando, the nurse who took care of Leah. Fernando, can you explain how did the error occur in the case of Leah?
Yeah, so I was listeners, but it was a crazy day. There was a lot of stuff happening, and well, she came in, she had her surgery for her chest, she got her epidural. We thought she was gonna be good, but she kept complaining of pain. Um, so we kept giving her fentanyl, her pain medication, and we just didn't have time to check. Her parents kept asking about how come she's still in pain, but we had other things to do, and well, nobody ever checked, nobody ever questioned anything, and I feel awful about it. It's not like it happens every day or anything like that, but um, I should have done my part.
Why was this classified as an error?
So unfortunately, um, there were many options that we could have taken. We could have assessed her, we could have checked her. This was a very likely preventable outcome, and we could have avoided Leah's death.
Can you explain to me why was this classified as an error?
Yeah, so unfortunately, the event resulted in Leah's death. There were many things that we should have assessed for and done. So after we gave her the pain medication, we should have came back and assessed how she was doing, her level of consciousness, if she was getting relieved. We should assess her epidural, making sure it's in the right spot. We should have noticed her vital signs. There are many things that we should have done.
Fernando, can you tell me some risk reduction strategies that you could have implemented in this case?
Yeah, so as I mentioned, it's a crazy day. But thinking back, there are many things that I should have done. I should have definitely listened to Leah's parents. I should have advocated for their concerns to be met. I should have questioned and verified the pain medications, the anti-anxiety medication. I should have double checked. I should have known. Even after I administered the medications, I should have come back and checked on Leah 15-30 minutes. And I should have reported any decreased respirations, level of consciousness, or unrelieved pain. I know from now on I will do those things, but I should have done those back then.
Thank you. What is the procedure when a patient safety event occurs?
So when a patient safety event, the first thing we have to do is we have to go assess the patient's condition. We have to identify any harm or complications that were done. We have to notify the doctor. We have to document the event and the interventions we took to correct the event.
Fernando, can you explain to me what are the national safety goals?
Yes, so the national safety goals are important to delivering safe and effective, high-quality care for patients. There are a set of guidelines. Just a few are identifying the patients correctly, so like name and date of birth, ensuring medications are administered safely, and taking actions to prevent mistakes during surgery.
And why are these important for the nurse practicing?
Well, they're important because they were designed to promote patient safety. They're tested solutions to common problems in the healthcare field.
Okay, thank you so much.
We are now here with the nurse educator for the hospital, Laura Sanchez. Can you tell us what constitutes a patient safety event?
So a patient safety event is defined as any process, act of omission, or commission that results in a hazardous healthcare condition or unintended harm to the patient. According to the Joint Commission, a patient safety event is a centennial event that results from death, permanent harm, or severe temporary harm.
And who is responsible for maintaining patient safety?
So the nurse role is to preserve patient safety and prevent harm during the provision of care in both short-term and long-term care settings. However, a variety of stakeholders, including society in general, patient, individual nurses, nursing, educators, administrators, and researchers, physicians, and government officials are responsible for ensuring that patient care is safely delivered and that no harm occurs to patients.
What are the rights to medication administration, and why is this important for practicing nurses?
There are 6 rights of medication, which are the following: the right patient, the right drug, the right time, the right dose, right route, and right documentation. These all help minimize the risk of great harm or even death to patients.
What are potential risk factors of patient safety?
They are death, medication errors, healthcare associated infections, unsafe surgical procedures, and patient falls.
And what are the roles of nurses in preventing medication errors or patient safety events?
The primary nurse plays a critical role in preventing medication errors. The nurse has a duty to the patient to know the actions and indications of all medications they administer, including safe dosage ranges, adverse reactions, monitoring parameters, and nursing implications. The nurse is responsible for notifying the doctor if there are any changes in the patient's condition.
Great, thank you.